am a first-generation college student, so when I went to college, it was a little bit hard for me to navigate and decide what I wanted to be. I didn't have many mentors at that time. I loved sciences and I loved the math, so I kind of wanted to get into the medical field. So I volunteered on an EMS squad, emergency medical services, because I thought maybe I would like that, as well as St. Christopher's Hospital for Children. And there I got to see firsthand what nurses and physicians do in the emergency room setting. And one nurse, Juanita Figueroa, I got to sit with her one day and I just saw her in action and it just inspired me. So one case that I remember was a Latino father rushing into the ER with his son who had just gotten hit by a mail truck. So he happened to be riding his bike and he got hit, and his father just quickly grabbed him and scooped him to the ER. So Juanita's quick action, of getting the stretcher, putting him on, we brought him to the trauma room and I helped her, I kind of stood back, but I watched how she just, took care of everything, her and her colleagues, her nursing colleagues. And then the physician walked in and I just got excited and scared and I said, this is what I want to do. I want to be an emergency room pediatric nurse. It's important to have more Hispanic nurses at the bedside because we have, Hispanics in general, have lots of barriers to health. And whether it be language, whether it be the access to health care, whether it's the fact that Latinos do not, most of them, what we see in statistics according to CDC, we lack in preventive care. So then when we find these medical issues, it's already far gone. We need more diversity in our healthcare to be able to educate and influence our community. So we can't do that alone. We need more Latinos, nurses, physicians, etc., to get into the field so that way we can address the healthcare needs of our community for our Latinos. We have more mentors. We have more role models. I think NAHN is doing a great job, my association that I belong to, of having that and pushing for leadership, pushing for more Latinos to join boards and become faculty members. So that way, these individuals can serve as role models for students. We have a big push for mentors, and they just did a huge ad campaign to be able to have a show on radio and TV that Latinos should go into nursing, that there is a shortage of Latinos in diversity at the bedside. So it's really great that we have more of these leaders in these roles, so that way those students who are interested in getting into this field have support when they do choose to choose nursing as a career.